Hey everybody, it's Jaden here, and today I am doing a tutorial on how to do a testosterone injection. Depending on whatever your dose is, that'll vary for you. Right now I'm on half a mil, which is 100 milligrams a week. I do it IM. You can do it, I guess. Some doctors said you could do sub-Q, but to me, I got taught that if you're going to do more than like zero point 0.2 milliliters of fluid, not to do sub-Q because that'll cause swelling and bruising and uncomfortableness. And if you think about it, when you get your TB test done, they do like 0.1 mil and it swells up a lot. So I couldn't even imagine doing half a mil in sub-Q. So, alright, so you're going to see me, I'm going to show you how to draw it up. I'm going to show you the supplies you need to get started. I'm going to show you how I inject. You can inject in the gluteus maximus or your butt. But that has started to not be a primary source to inject because of the nerve that runs back there. Sometimes people have accidentally hit it and you can get like abscesses or have nerve complications and stuff. It just is really, if you're going to do it in that area, be very careful. Make sure you aspirate your needle before you inject to ensure that you're in the correct spot. You should not get blood return. If you get blood return, you're in a capillary or an artery, vein, whatever, and you need to readjust your needle. If you're going to do it there, probably would be better for someone to do it for you just because it's a weird angle. I do mine in my thigh. So anyway, we'll get started on this. So you're going to need your vial of your testosterone right there. Yeah, see it? Yeah. I use a 21 gauge inch long needle. So we call them greens. You need a Band-Aid, 2 alcohol swabs, and something like I use gauze or something just to put pressure on it initially after the injection, and then a 1 ml syringe. So here, let's see if I can, that's as far low as it'll go. So I have something to back up for this. All right. So what I do first is I prep my needle. You want to do this cleanly, not aseptically or anything, but clean procedure, which means minimal bacterial, sterile. Everything in these packages is considered sterile, so we want to maintain the integrity of the packages. So I open both like this. So you see them like this. I haven't touched them. They're still in the wrappers. I then take my syringe and I connect it right to it and screw it in. And then remove it. This has a cap on it, a safety cap, and the plunger, you can pull a plunger, nothing's going to happen. Biggest thing, not that it matters for you guys, but number one source for bloodborne infections in the hospital is from needle sticks. That's why you don't recap. I will show you how these needles have a safety glide now on them, so you won't have to try to put the cap back on. Many of us still do it. It's old habits die hard, right? I'm just going to get the rest of my stuff kind of ready. I like to have everything ready before I do it. So I just get my Band-Aid undone. You may or may not need it. I would recommend using it because you are going to bleed and you don't want to lose the testosterone because sometimes it'll push back out. I use just some 1x1s to put pressure on. There's 2 really good reasons to put pressure on your site. One, you're helping reduce bruising that may occur. 2, once you inject, steroids are very thick, can be pretty painful. it provides a good padding for you to massage the area after you've injected. So then you're going to take your alcohol pad, one of them. You're going to take your vial. You're going to, for 30 seconds, is what they teach you in nursing school, clean the top of this vial vigorously. You want to hear like squeaking, friction is what kills the bacteria, not just the alcohol, right? So clear it off really good, blah, 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 blah. I'm not going to do it for 30 seconds because bad example. All right, so then this is thick. You're going to have a little bit of challenge if this is, your first time injecting. It might be difficult for you to draw it up. It doesn't matter. Most of the time when they teach you to draw up things, they tell you pull back the amount you need or past it and then inject the air into the vial because it will be a negative pressure type thing and then the liquid will come back into the syringe. That's not how it works with testosterone, though it does help. So I've pulled it to about 0.6. Can you see that? You may or may not be able to. I don't know how well that's focused in. So then I'm going to take the cap off. And this is where I'm going to show you. This thing right here is the little anti-stab. This is the safety lock glide switch. I'll show you what that does here in a minute. So then take it, push through the rubber, turn it. I'm running low on mine. I'm about ready to start another bottle. So get the liquid to where you can see it. See how it's moving around in there? Inject the air. I pull back a little because that's where the liquid's at. So slowly pull back and you'll see it start filling that syringe. Slowly start filling the syringe. Sorry. Trying to get so you guys can see it too. Alright, there we go. Hopefully you can see. And you see how slow it's taken? There's a big old bubble in there. This is so hard to do. Ugh. This is so hard to do on video. Usually it doesn't take me this long, but I think my nerves are getting the best of me. Alright guys, I'm going to draw this up how I would do it because this is messing me up. It doesn't take this long. Should not take you that long. Alright. Okay, so now you see I've drawn up a little bit more than I need. And there's also an air bubble at the top. I don't know if you can see it. See it right there? I try to push it back in because then I get a more accurate reading of what I'm at. You're going to inject a little bit more than what your dose is because of what's lost when you do this. To get air bubbles out, you can flick it, but you can also, tap it on a desk or whatever. So then you're going to aspirate it a little bit. Make sure that you see testosterone coming out of the needle to get rid of any air bubbles you may have. So once you see it cleanly flowing evenly, you know you've got it. See? Okay. Rule number 1, though. This is what most people do, and it's very frustrating, though it's an easy fix if you do it. Do not flip this switch once you've gotten this. This is one of those times where if you're gonna run around with this or something, you could put the cap back on. The way to do that, and I can't move the computer down to show you, so I'm gonna do it the not proper way. The safe way, if you absolutely have to recap something, is to set the cap on a flat surface and scoop with the needle until you get it in. Right? So now it's safe. And you can set it down and it'll stay sterile. The cover will completely protect you. So now the next part is the injection, which I have no idea how I'm going to record. I guess that's a good angle right there, right? So, last week I did my left thigh. This week I'm going to do my right. It's important to alternate your thighs to reduce your scar tissue buildup and whatnot, what have you. Take an alcohol swab. Clean in a circular motion the site you're going to inject in. Let it air dry. Now, while it's drying, I'll tell you, here are the keys for doing an injection. You might be used to this, you might have done it for a while. If you are new to this, here are some key tips. You are injecting a 21 gauge, 1-inch needle into your leg. It can be intimidating. Some people really hate needles. Your leg is really thick with muscle, so you're not going to hurt yourself. If you're a skinnier person and have less muscle mass, you might want to consider getting a shorter needle maybe, but you need at least a 1/2 inch. Whereas if you're a bigger person, you might need a little bit longer needle, like 1.5 inches. Depends on where you're at. I'm a pretty lean person, so 1 inch is fine. The secret to a painless injection, which my patients love, is when you do an injection, the secret is to not slowly inject into, slowly insert the needle into your skin, because that's going to hurt. It's more of I don't want to say stab, but, a quick jolt. Don't go like Michael Myers on you. Aim correctly, be responsible about it. But a quick insertion will help prevent the pain. It also may help prevent you from being psyched out. Once you get the needle in your leg, slowly inject the liquid. If you just ram it in, you're not giving your tissues a chance to absorb that. And this is already a bolus of liquid that's going to slowly absorb over the week, right? Bolus means a accumulation of fluid or medication, right? So you're going to increase your chances of having a tenderness on that part of your leg, a bruise. Inject slow, okay? You got a needle in your leg already, just inject it slow. So here we go. And I wish I had a better view. I don't. I'm sorry, guys. So, whoop. All right. It's in. You want to aspirate, pull back. No blood. Okay. So when you see that there's no blood, it's safe to inject. So I'm just slowly injecting. I've done this for a while, and I'm not afraid of needles. I'm a nurse, so it's kind of funny, right? I shouldn't be afraid of needles with how much I use them. Okay, so I've injected it. Then I'm going to take my 1x1 gauze. I'm going to draw this needle out, and I'm going to put pressure immediately. Okay. Now, while I'm going to show you this, I'm massaging and pushing pressure on the injection site. Hold it for about a minute. This greatly decreases your chances of developing a bruise. Rub it gently. It decreases your chances of having a sore injection spot. So, remember I was telling you about this anti-lock thing. Now is the time you use it. Simply slide it up and it covers your needle. Now you don't got to worry about getting stabbed. This does not mean that you cannot get stabbed by this, because this is actually not really a great design for an anti-lock. And my wife and I have proven that there are ways around this. If you wanted to get this needle out, you could. I'm not going to show that, because you shouldn't mess around with the needle that much. If you want to be dumb and try to figure it out for yourself, I guess go for it. It's your own needle, but please just be responsible with it. Disposing it, you really should have a sharps container. What I did was I take it to work and dump it in the sharps container there. You don't have that option, get like if you have cats, get like a plastic litter scooper container, and once it's empty with the litter, dump them in there, and then write sharps on it. Some hospitals still take needles, but I know people that have diabetes and stuff have trouble with disposing their needles too. So, that'd be a question for you to ask your primary. That's about it. I hope you guys enjoyed this video. If you have any questions, just hit me up. So last but not least, put your Band-Aid on. Get yourself a sticker. You'll feel better. But yeah, hopefully you guys learned something from this video and feel more comfortable doing your injections. So good luck to all y'all, and thank you for viewing.